Hello, my name is Rachel. I'm Head of Policy and Campaigns at Target Ovarian Cancer, and I'm going to answer some of your questions about coronavirus. Shielding is about making sure that anyone who might be most vulnerable to the effects of COVID-19 is protected from these. This includes people who are currently undergoing chemotherapy or who might be on a PARP inhibitor. If you're in this group, you'll have received a letter, and it's really important you follow the advice in that letter in keeping yourself safe. If you think you might be in that group but you haven't received a letter, you should contact your CNS or clinical team to talk about the risks for you. If you have any questions about shielding or any concerns or just want to chat, please do ring our support line. If you are shielding or have been asked to shield and you have hospital appointments during that time, it's really important you talk to the team that are treating you about what to do. It might be that you'll go ahead with those appointments, or it might be they can be delayed or moved to phone or video appointments. Your team are the best people to work with you to work out what's best for your individual situation. We know how important time outside is, particularly if you're shielding. The official advice says that if you are shielding, you can try things like opening a window to get some fresh air in and finding a place to sit where you have sunlight and a nice view. If you do have access to private space, and that could be either a private garden or your front doorstep, you can sit out there and enjoy some fresh air as long as you stay 2 meters away from your neighbours or any other members of your household. If you're taking a PARP inhibitor, you might have been advised that you're at high risk and you'll need to shield. This is because PARP inhibitors can affect how your immune system works. That's how your body can fight off a virus, and might make you more at risk to coronavirus. If you have any concerns about what taking a PARP inhibitor might mean for you, please do contact your clinical team because they're the best people to advise. If you have to go to the hospital for any appointments, including chemotherapy, your team will be really aware of your situation and will do everything in their power to keep you as safe as possible. There might be some changes to how your appointment runs, like you might be asked to wait in the car until you're absolutely ready to be seen to avoid you having to wait in the hospital for longer, and any appointments that don't require treatment may be done over the phone or through video. If you want greater reassurance, you can contact the hospital and they should be able to tell you what precautions they're specifically putting in place to protect cancer patients. How quickly your immune system can recover from the effects of chemotherapy varies from person to person, and it's really difficult to say that somebody who's had chemotherapy recently is at more risk than somebody who's never had chemotherapy. If you finish chemotherapy in the last 3 months and you have any concerns, the best thing to do would be to talk to your clinical team, or if that's not possible, your GP, and they'll be able to advise you on your specific circumstances.